Check 1 2 3. Hello.
Test 1 2. Audio test 1 2.
Where is the next one? Where is the next one? Oh God. Good evening, everyone. I'm Niharika, and on behalf of the Bengaluru Science and Technology Cluster, an initiative under the aegis of the Office of Principal Scientific Advisor to the Government of India and the Bangalore Apartment Federation, I'm delighted to welcome you to the episode 6 of our public talk series on the science for sustainable urban living. This series is a collaborative effort between BAF and the BEST cluster. Over the past months, we have explored some of the most pressing challenges shaping urban life. From waste management and water security to sustainable mobility, energy, and urban farming, each conversation has helped us understand how science, policy, and community action can come together to make our cities more sustainable.
Bengaluru's got a new initiative to take on its biggest urban challenges. Let's see what it's all about. Ever feel the pressure of big city life? Yeah, it can be a lot, right? These challenges affect all of us. But here's the good news. Science has real answers. So, there's a new public talk series designed to help us find those solutions together. It's a team effort between the Bangalore Science and Technology Cluster and the Bangalore Apartment Federation. The whole idea is to connect scientific experts directly with residents just like you. The goal? To improve the city's resilience, its sustainability, and, well, our quality of life. Each session is super interactive. We're talking panel discussions with plenty of time for your questions. Over 6 months, the series is going to tackle some of the city's most pressing issues. But, the conversation doesn't just stop when the event ends. That's a core belief here. That's why there's a Q&A portal online, so you can ask experts questions anytime. The process is simple. You submit a question, an expert checks it out, and the whole community learns. All this great info will then get packed into a handbook for sustainable city living. It's really about using proven solutions.
Today, we turn our attention to an equally critical pillar, urban health, because at the heart of every thriving city lies the health and well being of its people. As our cities grow denser and more complex, urban health is no longer just about healthcare systems. It is about the air we breathe, the space we inhabit, the streets we walk on, access to quality healthcare, the food we consume, and the connections we build within our communities. This evening, we will hear from a dynamic panel of experts, practitioners, and community leaders as they share insights on building healthier, more resilient, and inclusive urban environments, from environmental quality and active living to mental well being, preventive care, health equity, and emergency preparedness. We are grateful to our partners and supporters who make this series possible. We would also like to acknowledge the continued support of the Indian Institute of Science, Socrates Foundation, Bangalore Political Action Committee, Bengaluru Post, Daily Hunt, and One India for their continued encouragement and collaboration. We are grateful to our partners and supporters who make this series possible. This episode is supported by the Bengaluru Sustainability Forum and IIM Bangalore NSR Cell, who continued encouragement strengthens this platform for meaningful dialogue and community engagement. We would also like to extend our sincere thanks to our stall partners Godrej Living, Genex Utility, and Systec India for showcasing their work and contributing to today's conversation around healthier and more sustainable urban living. Let me quickly take you through today's agenda. We begin with registrations and exhibition from 3 o'clock to 3:30 p.m., followed by the welcome remarks from 3:30 to 3:45. Our panel discussion will take place from 3:45 p.m. to 5:15 p.m., where our speakers will share insights on urban health and healthier communities. This will be followed by flash talks from 5:15 to 6 o'clock p.m., bringing in fresh ideas and perspectives. We'll conclude with networking tea from 6 o'clock to 6:30 p.m., giving everyone a chance to connect and continue the conversation. To set the context for today's gathering, I'm pleased to invite Sri Anantaraman, CEO of the Bengaluru Science and Technology Cluster, to deliver his introductory remarks. We'll now hear from Sri Arun Kumar from the Bangalore Apartment Federation, who will share his thoughts on the vision behind this episode.
Good evening and warm welcome to all of you. As we see, more citizens are coming in, but I think time is also very important. So let's start this wonderful program. Thank you very much for coming, and we know that it's not easy to reach here. So making it in time is very important. Thank you very much on behalf of both the Bengaluru Science and Technology Cluster as well as BAF. This is a wonderful series, and we are in the last and final episode of this cohort of urban life, and therefore I think it's a pleasure to meet all of you. I would take a few minutes to talk about the BEST as a cluster, and then maybe we'll take it up. So BEST is a cluster, Science and Technology Cluster, part of Office of PSA, that is Principal Scientific Advisor to Government of India. The role of the Bengaluru Science and Technology Cluster is an enabler. It's create a framework in the city. This framework helps to enrich the dialogue happen between society and the science, and identify the problems which the city face, and see whether collectively we can able to solve that problem through the solution which is available within the city. And therefore we strive and take many of the problem with the city face and see whether we can able to solve. Now some of the example which we are working are health. We are talking about One Health, we are talking about digital health. I think Bangalore is also expanding. We see a future of Bangalore in next 20-30 years time. Agriculture is very important. Land area is shrinking. But the beauty of science and technology is it has a solution for the shrinkage itself. So can we increase the yield by using technology? Therefore, we are talking about precision technology as one of the area. The other thing I think you would have felt when you are coming to Banargata Road, which is mobility. We have taken mobility as one of the theme where we see whether science can able to play a different role. The good thing is world is now disturbed or changed with the advent of AI, ML and other technologies, and therefore right use of AI into mobility, we believe strongly that we can able to find some other solutions for the perennial mobility problem. So eminent scientists, industries and startups are working and see what we can do. The last one we are working is on water security. I'm sure, I think you will agree with me, that's one of the foremost focus area for the city. Again, the rapid urbanization and obviously generation of large wastewater provides an opportunity also. I mean, at the same time, it's a concern on how to reuse the wastewater itself. Now, again, we see a play of science and technology here to see whether we can able to increase the wastewater reuse, for example, in terms of the citizen welfare measures. So, some of the areas which we are working best cluster. Now, coming to this particular program, we have a 6-episode series starting from water, we are talking about waste, we talked about EV, various things we covered out. And finally, we have reached to urban health. We feel it's a excellent process because ultimately, whatever I said about urban health, or agriculture, or we are talking about waste management, or we are talking about water, finally has to result in a good health for the citizen. So we kept this at the last one, and it's not the least one, but most important one. We are going to talk something which is very close to our heart, literally. So that's the today's episode. And I want to congratulate and thank all the citizens here. So we got excellent response for the last 5, and here also we are getting tremendous response from the citizen, and the participation is very good. I would also thank sincerely the BAF as an organization, and our good friends Arun is here, Satish will join, and other BAF team member. Without their very active involvement and very passionate involvement, it's not possible. So therefore, I would definitely want to thank BAF team for the excellent support which they have given. I think big round of applause for Arun is here, and Satish will join, and Arun and team is here. So I also want to thank the panel members here, and all of them I think are very eminent people. I think we will be introducing them shortly, and I would like to thank each one of them. They have come from very long distance, I can see that, but I think they have taken a lot of effort to reach here and to share some of the best thing which we can discuss about urban health. So with that as initial remarks, I would once again thank all of you for making your time to come here, and I'm sure I think you will take back some enriched discussion topic, and you will also share your ideas to this. We are not going to make it as one-time event. All the 6 will be summarized, and we are trying to roll it up as a booklet, which then we would like to pass on to the right decision maker so that they can see some topics which they then use it out. So it's a continuous improvement exercise which we are planning as a part of this 6th series of episode here. We call it as Citizen Dialogue, and therefore we would like to thank all of you for coming here. Thank you very much. Wish you all the best. Thank you.
Thank you, sir. Following this, we will hear from Shri Arun Kumar from Bangalore Apartment Federation, who will share his thoughts on the vision behind this episode.
Thank you, Niharika. Oh, there is Satish. Satish, would you like to address the gathering? Okay. Thank you so much. Wonderful to have all of you here. Glad you were able to make time on this Saturday afternoon. We've been doing this over 6 episodes, like both Niharika and Mr. Anantaraman have mentioned. And each of them have been important topics, relevant topics, and at least for some of us it is exciting topics also. And making sure that we are listening from citizens. I represent Bangalore Apartments Federation. We are about 1,500 communities across Bangalore, 1,500 apartment complexes across Bangalore, representing about 16 lakh people or so, and growing every day. And there are various kinds of challenges on various subjects, and we picked up some 6 important subjects. These are not the starting and ending of all the subjects. There are many more subjects, but we picked up these 6 priority subjects and have dealt with in reasonable level of nuance in each of the session. We've had a wonderful set of panelists, and many times, like Mr. Anantharaman was mentioning, we want to take it to the decision makers, which is probably the government or the civic agencies, etc. And in some of the events, we've had the civic agencies also present, the government also present. So we are hoping that they've heard us and heard us clearly, and taking it back to frame policies, frame procedures, etc., to make sure that it just doesn't remain an academic exercise in a conference room like this, but go back to implementation. We continue to follow through each of these subjects, and it's not that at the end of 6 events only we will be discussing and negotiating with them. For example, just the previous week we met the Bangalore Development Minister and handed over a charter on multiple subjects, on the treated use water subject, on the waste management subject, and the overall governance of Bangalore also. So, and he was very receptive, and hopefully take some decisions, etc. For us, citizens are important, citizens' aspirations are important, and we want the city to be sustainable, people to live in a sustainable environment in our dear city. So to that extent, these subjects impact us, not just me, my family, my neighborhood, my community, my street, my locality, everyone. So these learnings, hopefully, today's learnings on health is extremely important. We will take it forward, and there are multiple aspects of apartment living, since I represent Apartment Federation. The quality of water, the quality of air, the health impact of water quality, and so on and so forth are very important. And we are many of our communities are townships by themselves, are self-governed, and so we need to make sure that we do the right things when we are administering our respective communities. So there will be takeaways. I believe this session is going live on YouTube also. Is it? It is going live. So hopefully we will, some of us are seeing it from home, and we will also have these recordings on the YouTube channel for posterity and for future to see. So if any one of you, your community members, friends, family, etc., missed it, please refer them this. I warmly welcome the panelists, esteemed panelists for this session, and I'm sincerely and very grateful to Best Cluster for their partnership with us. We have done these 6, and I'm sure that it opens up a new horizon of future collaborations with Best Cluster also, and taking things collectively forward with the government and agencies at whichever level, local, city, state, country also, because you have a lot of national connect also with the government of India. So with that, I warmly once again welcome all of you for this event. Thank you so much.
Thank you, sir. As our cities grow more denser and more complex, the conversation around urban health becomes more urgent than ever. The quality of our air, water, public spaces, mobility system, and access to quality healthcare all play a vital role in shaping how healthy and resilient our communities can be. Building healthier cities is not just about treatment, but about prevention, equity, and creating environments where everyone can thrive. To begin today's discussion, it is my pleasure to welcome Mansi from BSF Bengaluru Sustainability Forum, who helped us to put together an esteemed panel for today's panel discussion.
Thank you so much. Can I please have the slide on BSF? I'll just quickly introduce what we at Bengaluru Sustainability Forum do. So BSF is an interinstitutional initiative. We convene conversations on water, biodiversity, mobility, climate and urban planning, waste, all the thematics that have been referenced already. And we try and look at what a sustainable future for Bangalore could look like, and what is it that we as citizens also would like to see, where does science fit in. And to do that, we organize retreats where we invite practitioners to come in and talk with others, with other stakeholders, to have interdisciplinary approach to some of these challenges that our city is facing. We also organize film festivals. We do podcasts. Recently, we concluded a podcast series called Climate Charche, where we looked at how climate is intersecting with various city systems and what does it tell us about livability and sustainability and the city. And I would encourage all of you to please go and watch it. We have Azim Premji University, Biome, NCBS, Science Gallery, Bengaluru, Wipro Foundation and IHS as our partner institutes. It gives us great pleasure to have helped and collaborated with BEST to put this panel together, because more and more through the work that we are doing, we are realizing that most of these issues are very intersectional, and to solve one, we have to look at where others fit in. And health especially is very closely related. And so, how do you think of health not at the point of needing a hospital, but much before that? It was our approach when putting the panel together. I would like to welcome the panelists. Dr. Swami, he is a professor at Tata ISC Medical School with extensive experience in medicine and research. Dr. Swami brings valuable insights into the intersection of healthcare systems, preventive health and urban well-being. We look forward to his perspectives on building healthier and more resilient cities. I would like to welcome Dr. Pragati Hebbar, DBT Wellcome Trust India Alliance Fellow, Dean of the TT Narasimhan School of Advanced Studies at Institute of Public Health and board member of Health Systems Global. She is a distinguished public health researcher and leader whose work focuses on strengthening health systems, advancing health equity, and improving access to care for underserved communities. Rohan Patankar, an architect, urban sociologist, and design researcher whose work explores the intersection of cities, public life, and social systems. And lastly, Dr. Maheshwari, a public health consultant with the Greater Bengaluru Authority. She will also be moderating today's panel. With her deep engagement in urban public health and governance, Dr. Maheshwari works at the intersection of city systems, health planning, and community well-being. So yeah, I would also like to acknowledge my colleague Vinita. She is here with us today and she also has worked a lot in putting this together. Thank you.
Thank you, ma'am. If the audience has any question for the panel, you may simply scan the QR code shown on the screen and post them anytime during the discussion. Over to you, ma'am.
Thank you. Representing and sitting here, it's my alma mater also, it's a pleasure. And sitting with these dignitaries itself, it's going to be a tough job to moderate. When I see health as a medical practitioner, health is by definition, people say it's not merely absence of disease, it's a state of well-being, of medical, social, mental, holistic approach. But when I was just passing by, somebody was commenting, health is more about diagnostic centers, hospitals being a front end. Thank you, sir. Thank you for that idea. So, all of you, when you see health, you don't see health as life. Like from day in, when you get up to sleep, or even during the sleep, health is a part of you. Health is you itself. But generally, health is seen as doctor, pharmacy, and diagnostics. So now with that onset, from a person who is born, lived in Bangalore, if you see what is the biggest threat to a healthier Bangalore in a decade's time, sir, to Professor Swaminathan?
Yeah, I think I'm new to Bangalore and I'm here only last couple of years. But the biggest threat I see being new to the city also, it gives you a perspective. I lived abroad for nearly 3 decades, so I see the big difference in certain measures which can impact health. So one of the first thing I will take up is, we have lost the green space. There are a lot of concrete buildings, and there is significant amount of traffic and air pollution which people are dealing with day in and day out. And crowded apartment buildings which are sprawling in various corners of the city. So essentially what's happening is that there is a high-risk lifestyle. People are in rush all the time, traveling for hours in a taxi, getting exposed to air pollution. And there is also a disruption of sleep, or basic rhythm of life, and people are waking up late, and because of the needs of the job and profession and travel and so on and so forth. And again, the other big change I noticed that you just walk around some of the brigade streets or other places, the kind of food the younger generation in particular they're eating, the number of fast food chains, and forget about fast food, the number of sweet shops, right, which are the Indian savories and things like that, which we used to eat maybe once a year. Now people are having those snacks available almost on a daily basis. And the last thing I want to touch upon is the sedentary lifestyle, which the urban life really kind of enforces. So people are really having a lot of comfort of travel and car and all that, and so day-to-day activity is so limited. So you put all of this together, where people are not moving as they should be, people are eating what they should not be, people are breathing what is not good, and there is no good nature around, and there is tremendous amount of stress, and they are not sleeping when they should be. So the consequence of that is going to be a very disastrous outcome on human health. So this is the biggest worry I have when I look at the population. And the other last point I want to comment is, population is very young. We have a lot of people in age between 19 to 35. So we are going to be dealing with a lot of chronic diseases down the line, cancer, cardiovascular disease, and so on and so forth. We're going to get to a situation it's going to be very difficult to manage.
So you mean to say non-communicable diseases? In a trend of decadal trend, you will see a higher upper hand on non-communicable diseases compared to the rest.
Absolutely.
Thank you. Now to Dr. Pragati. From public health perspective, what concerns you the most, the way Bangalore is growing?
I think I'll pick up from the last point that Dr. Swami made on physical inactivity. If I were to pinpoint one particular factor that concerns me a lot, is the convenience, the consumerism. It's available at our fingertips, everything. The kind of lifestyles that we lead, the sedentary workforce. If we just do a show of hands, how many of us engages in daily exercise, for example, walking at least 30 minutes every day? Wow, that's great.
Now, their presence here itself is a sign.
Yes, so that's true. And because if we look at the data...
Also, you should see there are so many seats vacant.
So we don't know yet. But if we look at the data, at least the level of physical inactivity considered appropriate is just 150 minutes per week, which comes down to 30 minutes a day, right? So 2.5 hours in a week. And 1 in 2 people are not able to meet that in India. If you look at the 2019 data from ICMR, that's the scenario. So that leading to mental health ailments, to obesity, overweight, and all these interlinked issues. So I would say that physical inactivity for me seems like a major concern in a rapidly growing, urbanizing, convenient city that we are currently in.
Okay. Now that to Rohan, she's saying physical inactivity. Now that city is growing so far, no footpaths to walk, no proper roads, travel time being 2.5 hours to a destination. Where do you see this growing concern in planning, or say the way it is growing? How do you strategize Bangalore's growth?
Yeah, maybe some context before I start. Firstly, to just clarify that I'm no expert in architecture and urban planning. It makes me a little bit nervous to sit amongst all of you. But thank you for the opportunity. I will speak as someone who lives in the city, walks in the city, and experiences in the everyday. Of course, with some background in architecture and urban sociology. So I am speaking from the social sciences, so to say. Actually, a lot of what I wanted to share, Dr. Swami has already kind of shared. And to me, what was striking was the overarching sort of underlying thing that's happening below that, which to me is this decline in the idea of public life altogether. I have a suspicion that we are slowly forgetting what it means to live in a city, to live and to think about who we are to each other and how we are to each other. In a world where there is all of this information that we sit on top of. Of course, there's data, there's high levels of access to information, but there's also deep inequity in some way. Walking is a luxury in many ways, right? To even be able to have the fortune or luxury to spend time in the city and feel present and connected to it, I feel, is the big challenge that I see in front of us. And in fact, once we get to addressing some of that, we'll be able to address some of these interconnections or see them, in fact, as interconnected things, right? So some of the direct sort of connections are around accessibility to public space, parks, social infrastructure, public infrastructure, how much we make claims to it as well as a people together. But also, some of these challenges that we'll see in front of us as we go forward will also not land on us equally, right? We know that the most marginalized populations will experience heat much more, flooding much more. We already see this on the day-to-day, right? The number of days that people lose on labor or wage is significantly much more on people who are doing informal work, for example, right? We're all often ordering things on the internet and on Swiggy and Zomato, but in fact, the people who are doing most amount of invisible labor is in fact gig economy workers, etc. So I feel like we are living in multiple cities at the same time, and we're losing sense or touch of that. And I would be really curious as an architect or a designer of not just urban space and systems and policy, but also some of these design systems to think about how do we see each other better and more fully, I suppose. Yeah.
So here the thought process is, citizens of Bengaluru need different health needs for marginalized population, or for a middle class population, or for an elite population, or a person living in a well-designed apartment complex, or a person who's living in a slum area. So that's what you meant.
Or in fact to say that in fact we need the same things
for everybody.
Yeah, and we need to raise the bar for what the bare minimum is. Okay. And we need to ask that for not just ourselves or people like us, but also the domestic worker, also the informal worker. Yeah.
Now to Professor Swaminathan. Are we designing cities for diseases, or are we designing diseases into the cities?
Yeah, actually, the way things are structured, we are setting up for the risk from diseases, right? That's the way I'll put it. And because of a variety of reasons, and one particular thing I also want to really bring up here is, the risk of, epidemic infections, for example, right? And so where there is clustering of population together, right, that we are seeing in apartments and all that, like mini kind of thing. So then dengue infection or, various types of other infectious outbreaks and so on and so forth. So we see that, in COVID, we saw that, right? Within the big 1,000 or 10,000 household kind of apartment buildings, we see like multiple members getting infected and so on and so forth. I think the way we are structuring this, it's kind of definitely predisposing to some of the emerging risk in the future. And of course, non-communicable disease is something we already discussed about. There are walking spaces in some big apartments, which people who are living can use. But then our streets and roads are not really walkable. That's a big issue. The way cities are planned, and in some places, like the roads are uneven. People are at risk of fall. Particularly you got a little bit older, and all those things. There is no specific pavement, that was really thought about alongside the road, for walkability and all that. So I think in a way that I would say that the way cities have been built and structured, we have not had a forethought how the cities should be to prevent either non-communicable disease or communicable disease, like an infectious disease outbreak and so on and so forth. And again, add to that is drainage systems. We have very poor drainage systems eventually, and that again leads to breeding of various insects and vector-borne diseases and so on and so forth. I can't think of a city which is really well planned from a citizen health perspective that I can refer to in India.
I think the planning committee doesn't have a medical or a public health expert in it. It's always an engineer who is planning or a geography person who is planning the city. Now over to Dr. Pragati. Now that you have seen public health data or population data, do you see any concerning data changes for a particular disease or a disease pattern due to this urban health changes?
Definitely. I think if we see, like in public health, it's about populations. It's not individual data that we look at, but something as a whole. And what we see is that trends or epidemiological trends of how diseases come and go. So several decades back, it was largely infectious diseases, women dying during childbirth, maternal health issues, child health issues, etc. But over the past 2 to 3 decades, it has shifted very much towards non-communicable diseases. And that's why most of our conversation today is circling around that. So just the deaths by non-communicable diseases from, say, 1990 to 2023 has close to doubled. So about 37% of deaths to now 66% of deaths can be linked to non-communicable diseases. So it is definitely a shift in pattern, and a lot of factors, like we've been discussing, are related to urbanization or the rapid change in our own lifestyles, how each of us is experiencing it.
This is to Professor Swaminathan. Now that you have a global experience of working in different universities, do you think non-communicable diseases are just categorized as personal lifestyle disorders, or is it oversimplified, or do you see a pattern?
Right. I think there is a pattern, and in fact, there is a particular concept called exposome, where you have a interaction of multiple exposures coming together. See, for example, if you are an Asian or an Indian, you have a genetic predisposition to metabolic diseases like diabetes and all that, because how our genes are made up. Then on the top, if you start adapting a very sedentary lifestyle, then you start having obesity, particularly abdominal visceral obesity, which increases the risk of diabetes. Now the lifestyle factor is the second exposure. Now the third exposure in this context, now you add like living in urban kind of a thing, where let's say that a person with this type of a risk, right, is having a very stressful job. He doesn't sleep at night, and he has to wake up and then he sleeps during the day. There is a breakdown in circadian rhythm, right? So he's awake when he is to sleep, when he's sleeping when he is to be awake. So on, it disrupts the endocrine balance in the body, and it increases the stress hormone levels like cortisol and other things, which kind of goes up. So now that's the third thing that kind of comes in. I'm just giving you a scenario. And now this person has a family history of heart disease, right? That's a pre-existing factor. Now he travels and in a car and with a heavy exposure to air pollution. Let's say that he has to travel hour and a half on the traffic with air pollution. Just that exposure, the particulate matter and all that, it triggers inflammation in his body within that 1 hour. His C-reactive protein, all these inflammatory markers, they shoot up. And his platelets become prone to clotting. So that's where there is a study in New England Journal of Medicine where they actually showed that, exposure to traffic really substantially increases the risk of cardiovascular events like heart attacks and so on and so forth. So now you combine all of this together, and then he is eating straight going and then having a couple of pizzas. That's his lunch. Okay? And bottle of Coke. You put all of that together, now his metabolism is deranged, he is inflamed, his platelets are active, he's got a genetic risk and family history, all that. Now we hear a 42-year-old gentleman working in a software industry had a sudden cardiac event and he died. And we see that all in the media. And so this is the story that is happening in our society. So this is what is called as exposome. There are multiple things that kind of come together and they act on the same pathways which converge. And that convergence really goes and hits some of the parts of the body, like, for example, blood vessels are the most important thing. It increases risk of heart attacks and strokes as the most important thing. Again, increases risk of diabetes and other things.
This is to Rohan. I just want to know if unhealthy environmental living made normalized. Do you think unhealthy environment, which doesn't stimulate you for a healthy lifestyle, is normalized because of land scarcity or poor planning?
Yeah, absolutely. I think, I'd in fact like to continue on Dr. Swami's example of how it appears that urban planning is in fact at the heart of what shapes some of this behavior ultimately. Let's take the example of this person who probably lives in Whitefield, goes to Bengaluru and travels, 1.5 hours by car, which is why it's so stressful. There is no time to go shop. He's kind of probably ordering things on Swiggy because that's what's the easiest to do. It takes the least amount of time, which means that walking then has to be a chore that's kind of baked in or programmed into their life as an activity to do, right? And not something that's incidentally happening. You don't walk because you need to drop the kids off to the school and you're naturally just not doing activities that are close to you, but this is really because urban planning decided that we need to make like a SEZ where there will be lots of offices, and then to support that there'll be housing, there'll be lots of housing that'll be in another part of town, and then lots of people will be going back and forth on cars because somehow we need to make more cars, and it's aspirational to do that. Rather than for someone like this to build a life around their home and to find work that's closer to their home, and that becomes luxury, right? So in that way, certainly it becomes the norm then that you stop questioning these things because everyone around you seems to be doing the same pattern. So we've stopped questioning why it is that we've stopped walking to go buy vegetables from the store, what happened to human interactions in general, and see how it's all connected, in fact, to walkability, air quality, and loss of green spaces. And there's enough evidence to say that this is, in fact, the root cause of this is design, but it's design that was serving economic productivity and growth rather than health as a mandate, or as health as a lens was not even considered, and that sort of becomes the root cause for this. However, I was sort of thinking about this, and I thought maybe there is some value in looking for new evidence around, even if we were to do more localized studies on NCDs across different neighborhoods in Bangalore. Like I was saying, we live in multiple cities, and to see what an informal slum neighborhood, what outcomes on NCD look there versus an apartment building versus a JP Nagar versus a Malleshwaram versus a Banaswadi, and to see whether there are any connections or not specifically causations, but even if we found correlations to people's activities and their health outcomes, that might be meaningful work to explore to make some of this case.
I also feel there's a citizen's responsibility here. You don't get instant gratification of getting that 10% off if you order on Zomato, Swiggy or Flipkart. You have to go there and bargain for 5 rupees.
Yeah, but I will
So
also
it's
say,
citizen
if I
responsibility. The options are available for both of them.
Yeah.
I mean, in every apartment complex, definitely there is a buyer next to your door who is selling the vegetable, everything.
Yeah.
But I have to get down, go there, negotiate, talk, or I don't know Kannada, or he doesn't know Hindi.
Yeah.
All this is also a pattern of behaviors which citizens also have developed, and there is instant gratification of getting the discount on the app.
Yeah. If I could respond to that quickly.
Yeah, please.
So I happen to live in this neighborhood called Coxtown. I go to work in a studio in Cooktown, which is on the other side of this railway line, okay? So what I do is I get out of my house, I have to walk through this market, I cross this under the flyover, and then I take this railway crossing, sort of a footover bridge on top of these railway tracks, and I cross and move over to Cooktown. One day I asked my friend, who happened to be a woman, to join me on this walk as we went to work. And at the end of that walk, I was asking her how it was for her and whether she would do this every day, because I have, been doing this every day and it's completely normal to me. And she turned to me and said, that is absolutely not an idea that I would pursue, because what you didn't notice was that actually there were lots of men hanging out in that corner that looked a little bit shady. There were several stretches in the walk that were not really lit. At several moments, I wouldn't have considered doing this if you were not next to me, And so it also is brought to my attention that actually our experience of navigating the city is completely different based on who we are as people. So particularly the elderly, the children, people that are not cis-het male, have completely different experiences of the city and navigating it, and often we overlook that. And yeah, maybe the goal is to make cities that are safer in urban environments, so not just working on the physical infrastructure, but also some of these other critical sort of aspects that end up making us make the choice of ordering from the apps.
Okay.
Yeah.
So this is to Dr. Pragati. Do you see prevention is getting enough attention?
Coming from a public health space, I think that's like a perennial pain point. If prevention had got a lot of attention, I don't think we would have been sitting here and discussing quite a few of these, long-term issues. I mean, just for example, things like in the larger basket of non-communicable diseases, an issue like oral health, how many people, consider it as a priority? And if that gets integrated to something like the primary health care, so many diseases, including systemic diseases, non-communicable diseases, can be identified, screened much earlier. So if we were serious on prevention, I think a lot of these trends that we are seeing today could have been avoided. Non-communicable diseases, for example, the kind of toll that it's taking, and more so on women. So there is a gendered lens even as per the data. If we look at the prevalence of non-communicable diseases, is much higher in women across urban as well as rural spaces. So energies including funding and making it something that people would want to engage and do, rather than it being seen as something separate. If that gets integrated into the entire continuum, there are chances that we can avert a lot of the grim picture that some of us have discussed of 2035.
Thank you. Sir, in your previous discussion, you mentioned about air pollution. Bangalore was once Garden City, then it became Silicon City. Now it has become food city. Next, I think it will become pollution city. So what do you think? Air pollution, do we underestimate its long-term clinical impact on health?
Right. So normally when we think about air pollution, we tend to think in terms of, breathing issues and things like that. It's very common to make that connection. But
and also, sorry to interrupt, Bangalore is also allergy capital of India.
Yeah, right. So, but what's very important to recognize is when we are getting exposed to air pollution, it's having an impact on the entire system. So, so there are like small, tiny particles that we don't see in the air. They're called particulate matter. There are different sizes, like 0.1, 2.5, 10, depending on the size of the particle. And these particles, once you inhale in the air, they can actually cross your airway tract and epithelium and all that goes into your circulation. And some of it, they can go through the nerves on the roof of your nose straight to the brain. And these are studies that were done in Mexico, where they really showed that there is an accumulation of some of this particulate matter in certain parts of the brain. So there is a risk for cognitive health. If you have a prolonged exposure to pollution, then it's straight going to the brain. That's one thing. Second, of course, it can increase the risk of lung diseases and lung cancer. That includes like allergies, asthma, and chronic COPDs and things like that. So a lot of even young children, like you see that they repeatedly come to clinics nowadays needing nebulizers because of that. But in addition, these particles, they also carry few other things that are harmful to the body. They can actually carry antigens. So the particles can carry antigens that increases risk of allergic diseases. And these particles can affect your immune system directly. So it makes your immune system more predisposed to allergic diseases. So it's like a double hit, right? It exposes your body to antigen and then makes your immune system react to it. So that's why the risk of allergy really, really goes up. So like that, there are a lot of consequences to the thing. But two other things which are really missed out very commonly when you think about it. Air pollution directly increases risk of cardiac and vascular diseases. So the risk of heart disease, strokes, and even vascular disease really goes up because that's what it does. The second thing is that it also affects your metabolism. So it can increase the risk of fatty liver, or now it's one of the most common reasons people are having liver failure and needing transplant and so on and so forth. Your entire metabolism, like insulin resistance, everything really, really goes up. And it can increase the risk of kidney failure. Now there is a whole effect because some of it goes to the kidney as well. So there is an internal organ effect. So there is a systemic effect of air pollution. So that we need to think about what we are getting exposed here.
So air pollution, asylums, doesn't affect only respiratory system, affects us as a human body altogether.
Absolutely.
Immune system affecting is a new thing. Thank you, sir. To Dr. Pragati. Do you think air pollution is the new tobacco? Or is it justifiable comparison, or do you think I'm merely comparing them?
No, not at all. In fact, if we look at data, it actually surpasses, so with say tobacco, in a year about 1.3 million deaths occur. Whereas just with air pollution, the ones that are linked, it's 1.67 million. So 16.5 lakh people in India are dying because of air pollution. And the stark difference between the two is that tobacco usage is a choice that people take. So someone who wants to use it picks it up. Air pollution is not in our control, not in an individual's control, right? So you don't have a choice what kind of air you are breathing in your apartment, in your community. So that is sort of a very big issue that separates these two. So it's definitely the new tobacco, or even worse, I would say, than tobacco. Yeah.
Okay. This is to Rohan. What correlation do you see in urban planning and air pollution?
Yeah, I mean, there's lots, particularly like I was saying, how if neighborhoods are planned in this way that there is big neighborhoods where car driving is the only mode that's possible, it's likely that everyone who's on those roads driving those cars is also exposed to immense amounts of pollution, right? So that's the most simplistic sort of way of saying that. Increasingly, I mean, we've understood that there are ways to reduce, so the question is, how can design be used, I suppose, to solve for or address air pollution? One is whether you can solve or use design to reduce air pollution altogether, which would in fact mean things like moving industries away, or encouraging lots of people to move away from cars into public transport and creating enough last mile connections that people feel like it's more convenient to in fact take public transport than it is to drive cars. Those would be behavioral ways in which to in fact eventually try to reduce air pollution in a local sort of area. The other thing could also be to minimize exposure to air pollution. So particularly for people who are already predisposed, to risk of, falling sick with air pollution, already have antigens or allergens that are getting activated. What they could do is move away from areas or neighborhoods that are like closer to the main road. There can be, of course, there's at an individual air purifiers and so on, which again, apartment buildings can also try to do and try to create as much amount of, covered surfaces that are not either concrete paved or empty, sort of open dirt in some way, because that's what leads to dust. So thinking about some of that could be strategies, or planting could be strategies to minimize your exposure to air pollution. But at large, some of these big moves are already ongoing or have happened and are beyond, so to say, our control. The big sort of highways are getting money to be made and so on. And in that sort of conversation, it feels like citizens have very limited sort of voices. And really, I would imagine the voices we have are in trying to do things that are differently done and then seeing where that opportunity is.
Yeah. How many of you reached here in a public transport?
Would you call autos and cabs to be public transport?
For me, at least autos and cabs are presently public transport. Okay. How many of you have an air purifier in your house? Okay. Can I know where both of you stay? Okay, you? Yes, sir. Anybody who stays in core part of Bangalore? Do you have air purifier at your home? Why this question is asked? Because of the number of trees and the width of the roads and the number of constructions that's happening in the core part compared to the peripheral part of Bangalore. Now, to come to Dr. Pragati. One of our one of our apartment federation members have asked this question. High-rise apartments and respiratory diseases, do you see a relation?
High-rise apartments and respiratory diseases. So yeah, I think like we've been discussing, it's within the context. So depends on where that high-rise is situated. In its entire construction procedure itself, a lot of the activity would have already happened. And within high-rises now, things like, the better ventilation or not. Some high-rises are planned in such a way that there is some amount of ventilation, cross circulation, etc. But in some places, it's not the case. So when that happens, a lot of these PM, the particulate matter that we've been discussing, so even within the households, if the ventilation is not appropriate, can have an impact on the lung health as well as various systemic diseases. Beyond that, pigeons and several other issues being within those nets. You see a lot of apartments now putting up those nets to avoid pigeons. So not only it's slowly touching upon a thing of One Health. It's not only human health, there are multiple areas that get intertwined. So just high-rise and respiratory issues, I think if we say, if there is a link, definitely. Is there a one single link? No, it's like multi-linked, different things impact it. There is definitely a connection.
Okay, now you raised an important point called One Health. So this is to Professor Swaminathan. One Health, I want you to express or discuss this concept in broad, because many of us are not aware of One Health.
So One Health, it's very simple, that everything in and around us, it is connected. That's the principle behind One Health. So essentially, let's say that because of urbanization, now animals get affected. And when animals get affected, then they may end up having certain diseases. And those diseases then get transmitted to the human. And so then there is a disease in animal that comes to the human, and like that. This is zoonotic disease, a classic example where what's happening in the environment really affects the thing. So for example, if you're having a flooding event, right, because of climate changes and so on and so forth, then you will see that there are breeding areas of water, there are mosquitoes and so on and so forth, and there are rats. So everything gets affected. Leptospirosis, for example, it's a type of a disease, right, that comes and affects the human. From animal, you can get brucellosis, So the One Health idea is that, everything that happens to the soil, the environment, the air, all the living animals in and around the human, they're all interconnected. So anything that perturbs any of these systems can eventually affect not only human health, but also animal health and the overall environmental health as well. So that is the general idea of what is One Health.
So One Health is human into the environment, and environment affecting the human health.
Exactly.
Thank you, sir. The most hot topic for Bangalore right now is water scarcity and water quality. So I live in a part of Bangalore where I have never heard of water scarcity and water quality. But now that I am also heading that, last year I was heading the whole system of water distribution system with BWSSB to the peripheral part of Bangalore, when I really realized, yes, there is a huge scarcity and a lot of water quality affected, the hardness of the water and etc. Do you see a clinical impact of all of this, either water scarcity or poor quality of water? Poor quality, I meant unhygienic, and also the hardness.
Yeah, no, absolutely. So water scarcity is a big issue, and access to potable water is even a bigger issue. So I'll come to that, in a simple terms. For example, we are talking a little bit about, some of the underserved population who are working in urban environments, like, migrant workers, for example, building or construction workers. So they may be working in a lot of heat throughout the day with not having proper access to the water. So that they may be undergoing cycles of dehydration without the knowledge, and that can impact their body, because it can cause damage to their kidneys, for example, and they can lead to chronic kidney failure in the long term. Likewise, elderly, as we grow old, our thirst mechanisms are impaired. We don't know when our body is having less water, because the mechanism is not telling us, the brain is not telling us that your body is lacking water, so we don't seek to hydrate ourselves. So particularly those that age, beyond 65, 70, 75 or beyond, then they are particularly prone to this type of dehydration episodes and so on. And so even in, people living in a very safe kind of a thing. So I think water scarcity itself is a bigger issue for the society, no doubt about that. Because water is our body, 70% of our body is water. Just like how 70% of the world is ocean, 70% of your body is water. So when you look at the world, you're looking at our body, they are identical, in that sense. So water scarcity is going to have a deep impact on animal health. See, for example, how can animals get affected? If animals are not drinking enough water, then milk production will go down. If milk production goes down, then it has a significant effect on human health. So like that. So I think people are very concerned about grazing cattle. You know, they go on the field and they are getting exposed to a lot of global heat. And so I think that's one aspect. The second aspect is lack of potable water. So then if your water is contaminated by variety of things, for example, heavy metal is a classic example, like, you know, arsenic in water is a big issue. Arsenic, when consumed in food or water, it can increase risk of certain cancers, for example. People can get cancers in the kidneys, you know, if you have exposure to heavy metals. Then pesticide contamination, right? You know, a lot of pesticides, they all bleach and reach to the water and it gets contaminated. Then you have contamination from endocrine disrupting chemicals, you know, which can change the hormone status in your body. And like that, again, microplastics, it's a big issue. I mean, you know, I go to some of the villages here and travel and I see people have thrown huge chunk of plastics into the rivers and the riverbeds are all contaminated. And even when I'm pouring milk for making coffee in the morning, I'm worried that we are cutting a plastic and then pouring a milk. How much is the amount of plastics that is getting released into the milk that you consume? So all these microplastics, as you know, they got huge effect on the body. It can, because body is not able to digest it, it can go and settle in certain parts of the body and can cause, like, you know, certain types of health damage and so on. And then transmission of infection, where water is contaminated and people get like waterborne diseases like cholera and so on and so forth. So water is so essential. We need it in adequate amounts and it needs to be portable and it needs to be not contaminated. Unfortunately, a lot of this depends on human behavior. And we are responsible for our own kind of a destiny where it is. I think that's where responsible citizens have a huge important role, as much as policymakers and other stakeholders, including the government.
With this talk, I remember recently when we visited an apartment complex construction, which was under construction, to do a heat study. I realized when the questionnaire was asked to the construction workers, I asked, how many times do you drink water? She said, morning, in the lunch break, in the evening. I asked, why? The water is in the ground floor, I work in the 15th floor. So I don't want to get down to drink a cup of water every time. It was a simple solution of bringing the water to the floor. It's as simple as that, but still, I heard that conversation and I felt simple solutions can make a lot of difference. Now, Dr. Pragati, what mistakes we as citizens or a community does in maintaining the water quality or maintaining the affordable, accessible water access to all its inmates? What mistakes do we generally make?
Yeah, so I think quality, as in you mean the portability?
Yes, portability of water.
So citizens, I think, we've seen every summer how things have been changing in Bangalore. Areas, the core areas, like you were also mentioning, there were spaces where water tankers were such a scarcity. But even then, with each year passing by, that has become a commonplace now. What is the quality of water that is coming in those water tankers? We are not aware. So just basic usage of the different kind of sources of water that we are tapping into. Construction, the kind of infrastructure that is happening in the city. Bore wells rampantly being dug, and the ground levels of the water that needs to be there is just depleting year on year. And every now and then you'll see some or the other local sort of solutions that people are trying. They're trying to see how they can make some effort at retaining or increasing the groundwater levels in Bangalore. But it is at an individual level as a citizen or within an apartment complex, say, I think it's something that they can have a little minimal impact. Rather, if it's taken from a systems view, that is when there can be a bigger impact. As apartment complexes and citizens, I think the basic things that we can try to do, or the mistakes that we do, is we sometimes just, the maintenance, for example, it just falls off the list, right? So unless and until there's a dedicated thought behind it to ensure that the waterways, the pipelines, the sumps, the tanks, everything are cleaned at a regular interval, that will not happen. So these are the things that at an individual level, at least, people can try to attempt.
How many apartment complexes do you have a plan for AMC of what she mentioned, of cleaning the sumps? And also, how many apartments do you take the water samples for portability test? Oh, very good.
Surveillance, yes, I think a very important preventive measure. So if people keep a tab on how things are going, I think they can avert. Yeah.
This is to Rohan. Designing water reuse as a city, where are we?
Water reuse as a city.
Maybe recycle,
Yeah.
STP, all of this.
Right, yeah. I think in terms of particularly what the RAF is doing, there are lots of models that have been proven to work. There are people who are doing the work. There is grey water harvesting that's already sort of recycling that's happening and sort of minimizing what that can be and then moving that on. There's also decentralized like DWAT systems that also at institutional levels there are enough cases or case studies for us to look at. I think the question for some of this is how do we mainstream some of these ideas and in fact get more and more people to start accepting them and think of these things as things to do in their day-to-day. I think that's where some of those challenges are. And some of this is around both communicating the urgency of how this is required to be done and it needs to be done as soon as possible. Otherwise, every summer we will keep seeing drier and drier days and we will find it difficult to manage. But also that alternatives or solutions exist and they are possible and have been done within the city and really make more usable, easy to see and adopt sort of guidelines, playbooks, toolkits on some of this. So I feel like some of the intelligence or knowledge on this which has been demonstrated exists in the city. There is more and more and more need for us to start mainstreaming it and not, and sort of skip beyond the media cycle of the heat wave and the water crisis and think about how do we bring some of this into our everyday conversation. And maybe some of that is around thinking about extending this conversation to beyond apartment complexes who are only talking about it when there is no water, but in fact extend it to people who on the everyday find more challenging circumstances to navigate. And maybe there's some ideas there. Yeah.
I was fascinated by some of the video I watched. There is a water meter in every tap. So how many liters do you use for bathing? How many liters do you use for cooking, cleaning, everything? That kind of brings a sense to all of us to how many liters do we actually use. Last year when we were calculating how many liters is mandatorily required for every Bangalorean, we just came up to 25 liters per man. I was like, 25 liters, huh? I think I shower more than that. So that thought process change is required in each citizen is what I feel. Very crucial topic, hot burning topic, mental health. So, sir, this is to you, sir. Urban stress and mental health to medical health. Where do you link this?
Right. Certainly, there are many factors related to urban living that can have a significant impact on mental wellness. So I'm removing, the true psychiatric conditions, which are not dependent on, the urban environment. People get certain diseases, but I'm just bringing back what we can link it to urban living directly. So there are a variety of factors. One is, as we rightly discussed, there is a lot of stress that's involved in the lifestyle which an urban community is getting exposed to on a day-to-day basis. Particularly, I'll stress this to be more important in the middle age age group. And there is a lot of travel that happens, there is sleep disruption that is happening. And put all of that together, it has an impact on the mental health. And people don't sleep well. See, the other thing that kind of adds up to this is digital exposure. So, which becomes a necessary evil of urbanization or progressive careers we all have, right? How many of you do not ever see a message on your phone when you wake up in the middle of the night? 10%. That's the number of hands that was raised. Kind of tells us what is really happening. So essentially, the exposure to light, which it should shut up. There is a reason why sun is setting, right? Right, and I mean that's the way the nature is devised. Because unless the sun sets, then it sends a message to the body, and then the message to the body is that it kind of increases melatonin. It kind of you slow down your digestion. You don't eat at 11 o'clock. How many of you eat after 9 o'clock here? After 9 p.m.? There are few hands, which is not good. So essentially, see, body slows down. That is our body's nature. So the urban living, again, we are kind of disrupting various things. So so I think all of that together then eventually has, for example, the other area which we are not touched is gut microbes, right? So the kind of foods we eat, the circadian disruption we have, the stress we have, and everything. Do you know we have more bacteria in our gut than the cells we have in our body? So it's a larger community than our body itself. So that's how much power it has to really influence our health. So all of that changes, when we are getting exposed to this, and then air pollution has an effect on the brain. And then the light pollution, the sound pollution, you are getting inputs into your brain when you should not be getting inputs. So the effect of sleep disruption is that people don't sleep deep, they're light sleepers. They frequently wake up. There is the disruption of the sleep cycle that happens at night. And next morning, people are tired and so on and so forth. So essentially, and then this is one aspect. The other thing that's happening is there is an element of loneliness that has crept into the urban living. This loneliness doesn't necessarily limit to the elders. It's also true for the younger and middle generation of people. People live with a media friend, which is their AI, Gemini, and less with human-to-human interaction. Let me tell you this. When you hug somebody, you release the happiness hormone in your body. It's called oxytocin. That's why when the mother hugs the child, there is a benefit to the child and to the mother. Right? The mother releases the oxytocin, happiness hormone. So that human-to-human contact, again, is so important, and laughter, right? And a lot of us have become serious individuals, We don't seldom crack jokes, we seldom have friends and, communities and so on and so forth. And we are so about task-oriented, right? What should I finish next? What is the thing I need to finish, and all that, so on and so forth. So what is happening is that people, all of that had to lead to, and then the last thing, effect of inflammation. So when you're inflamed, your C-reactive protein goes up, your cytokines go up in your blood, spike up because of air pollution or a variety of other things, the KFC food, that you consumed. It's an inflammatory food. It upsets your gut, it spikes the inflammation. Cytokines go and directly affect parts of the brain. And the parts of the brain that are affected predisposes you to a depression kind of a wave. So diet has a lot of those type of things as well. So the inflammation is a thing. So put all of this together, you see a lot of unhappy individuals. And so I think this is the impact of the urban living we are having. And we are detached from nature, right? How many of you see the sun rise in the morning? How many of you are connected? Yeah, there are few hands. Those are like 70s and 80s that are rising hands. And how many of you are actually connected with our nature, right? Go and have a nature walk, look at a plant, and so on and so forth, because of the urban living, right?
We don't even know who is staying
Exactly.
next to us, sir. You're asking to go for a walk.
Exactly. So those are like, simple things of life we have walked away from, and all of that cumulatively has an effect on how what's happening to your brain.
Thank you. That's why Bangalore used to have a lot of Katte Balaga, coffee center, all of this. Now we don't have. It has become a heritage point or a vintage point for us now. This is to Dr. Pragati. From public health point of view, do you think this digital well-being should become a public health policy?
Definitely, I think the kind of trend that we are seeing these days, and just how he described how our lives and the way we interact with fellow humans, but also with technology, that is something that is definitely coming up. In fact, earlier the World Health Organization had the 4x4 framework for non-communicable diseases, which was diabetes, cancers, hypertension, and risk factors like tobacco, alcohol, etc. And to that now, mental health as well as air pollution both have gotten included to make it 5x5. So the digital well-being linked to mental health is definitely a space that needs a lot of attention in the coming years. Just the common mental disorders that we are seeing, the kind of prevalence within society, and a lot of it is also underreported because of stigma, because of just not even either identifying it or accepting it, that they are stuck in that digital loop. How many people we see losing lives just for making some content, creating content. Just this content creation has become such a big issue right now. So digital well-being definitely something on the cards for public health to look into.
It's as easy as today I have a fever, I take off, go to a doctor. So today I'm not feeling well. The same way today I feel lonely, so I meet a counselor. And I think in my daughter's school there's something called no bag day. I think in the adult age you should have a no phone day.
Definitely, many people do practice that sort of a digital detox. And in fact, when you were mentioning how in Bangalore, Kapi, sort of coming together, at our institute we have something called as Kapi Katte, where we, once in a month sit and take up topics which are not technical or so, but rather the software or soft skills of public health.
How many of you know that the phone setting itself has a digital well-being settings? Okay. It's inbuilt, just that you have to switch it on.
Yeah, can I just add something?
Yeah, please.
In design parlance, the katte is a third space, which is not work or home, where you can meet people for non-transactional purposes, right? It's also something that we assumed happened when we grew up, when you would run into people, at the sports complex, at the temple, on the street, by the shopping cart, like etc. And more, it's this kind of incidental encounter that's completely sort of reduced, and then so our lives have become more programmed. And of course, many more young people also feel the need to over-program it and then make appointments with everyone to catch up and so on. But at the same time, there's so many of us who are also feeling completely overburdened by work and are just about making ends meet and don't, in fact, find places also of rest and of leisure. So I would also say increasingly there's also a need to sort of acknowledge that and address that, especially with populations that may not easily find spaces for this. People with disabilities who do not have the ability to move out of their homes and socialize with people. Women often in low-income communities who don't have opportunities or the agencies to step out of home, and consequently face isolation, right? Like specific populations that get left behind and consequently isolated. And I mean, there's of course some artistic and creative work that has happened in the city that starts to address this. That also, in fact, makes the link that in fact, while we all need to show up in public space as anonymous strangers that live together, there is also great value in meeting people like ourselves. So it's really valuable for parents of a child with autism, for example, to meet other parents who have children who have autism, just to find spaces that work for them as a subcategory of people, because they understand their own needs quite specifically. So increasingly, there is also, thanks to, in fact, digital technology, people are able to meet each other on the internet and then find physical spaces to then continue that connection with. And I feel like there is also potential in thinking about not an either-or situation, but an yes-and sort of world where we're able to make the most out of both of these technologies that exist with us.
To me, I think the digital media the social media has more platforms than the physical media here. On ground, we don't have so many platforms, as many as that has been created on social media. And as a city, I personally feel disabled friendliness is not thought so strongly for Bangalore as a per se, compared to other metropolitan cities of India. Okay, now to go about climate change. How many of you are born in Bangalore? How many of you are here for your livelihood? Okay, the proportion is on that side. The second question has many hands than the first question. For a person who's born in Bangalore, it's definitely, at least for me, 4th generation living in Bangalore, I definitely see Bangalore getting traumatized. Yeah, I love my city more than the other cities. So also, maybe I have observed my city much closer. Every city for that matter. For a person who's not from Bangalore, who's landed in Bangalore, Bangalore is heaven. But for a person who's lived in Bangalore, I somehow feel, where is the heaven? I'm missing my heaven. So to that extent, where do you think climate change is going to impact on clinical health, either being non-communicable or mental health or any aspect of clinical health, where climate change is a factor?
Yeah, the effect of climate is going to be very profound and significant. And there are going to be more global warming events, and there are going to be flooding events that are also going to happen. And all of that will really affect the care that we provide and also individual citizens at various levels. See, for example, the effect of global warming can be causing recurrent dehydration, maybe even more than what we are seeing now. And the dehydration could mean that they're getting predisposed to certain types of diseases. We may see more kidney failure, for example, right? And and the other thing is the effect of global warming on people who are exposed to more ambient heat. They may be at risk of heat strokes, right? And we see in very small numbers now, but the numbers can be really huge.
Very alarmingly, when the government of India asked us, I was sitting in the position to report that, can you report heat strokes? I'm like, Bangalore should report heat strokes. Huh? Okay, fine, let me get the data. I was astonished I will get 0 as the answer, but I didn't.
Exactly. So I think the heat stroke can be a catastrophic condition where the core temperature in the body really shoots up more than 39 degrees. And then it leads to breakdown of muscles, and then it leads to activation of the clotting system in the body called disseminated intravascular coagulation, and people can die, from heat strokes. So it requires measures for rapid cooling and so on and so forth. So if we are going to see in mass proportion those type of individuals, then hospital systems may not be ready. So we need to have peripheral facilities to be prepared for that, to kind of induce like rapid cooling and then get the people stabilized and then bring them back and so on and so forth. But then the other thing I want to also bring up is, see, let's say that you are at risk for heart attacks or strokes. because let's say you have a high cholesterol and high blood pressure, diabetes, and so on and so forth. So your blood is already a little bit thick, right? There is a risk of strokes and all that. So now you have a heat stress in that setting, so you're going to increase the risk of those kind of risk as well, because it kind of causes increased blood to be thick and so on and so forth. I think this is about the global warming kind of a scenario, what you're going to see here. And also I think monsoon rains, unpredictable rains, and then we may have an increase in vector-borne diseases, right? Mosquitoes, there may be more, and there may be more vector-borne diseases. We may end up seeing, I think again because of the heat, then animals may move out of their habitat. So they may go to, for example, you may end up seeing a lot of snake bites, right? So I think there are a lot of consequences that how this is really going to affect the entire kind of a ecosystem. And then a lot of flooding again can cause like its own catastrophic problems and hospitals. So recently when there was a flooding in Chennai, which is about like 5 years ago, we knew that there was a hospital which was built in a very low level risk of flooding, and they had put ICU units with like some 20 beds. There are people who are on ventilators, and it was close to a canal or something that was flowing, and the whole thing flooded, and the ICU flooded. Tens of people died, and I don't know what happened. These are people who are on ventilator, right? So I think all those type of things, right, where people have kind of built things in wrong places and the flooding happens, and what's the consequence of the hospital. So I think there are a lot of things we need to really think about how we are going to handle with the climate change.
Now that's short of time, so I want each of the panelists to just answer a quick rapid fire. One habit every Bangalore resident should adopt.
I'll say 2, 3.
No, only one. Time short. What's the topmost?
Okay, I think topmost is physical activity.
Okay. Dr. Pragati?
I think mindful consumption of what we feed our body, mind, and the consumerism. So, yeah.
Rohan?
I would say go out for a walk every day.
Okay. Yes, sir. Conscious breathing. Very good. Okay. Now, again, one more question. One myth about urban health. We can start from sir. One myth about urban health.
I think the biggest myth is we have access to all the fancy exercise places. We have got access to all gadgets.
Exactly.
So we are healthier. It's not true.
True. Okay. Dr. Pragati?
Another thing is that we think that, okay, I mean, the counter side is that urban areas have different stresses, but rural health is also catching up. So the NCD shift that we are seeing is very quickly picking up in rural health as well with a rapid urbanization.
Next to Rohan. Myth about urban health.
That it affects us all equally.
Okay.
It doesn't land on us. We experience it differently from each other in our own unique ways.
Unhealthy state is equitable. Health is not, so at least unhealth is. Okay, just one advice for apartment association to maintain their health. As an association, what do you say? Immediately with this one thing that you need to follow.
Since we already spoke about walking and everything, rather I would say is that I think focusing on periodic events in your own communities to re-emphasize these ideas, right, about healthy eating and loneliness and so on. So all that, this is reinforcement is so important to take the essence of this meeting back to the community.
Dr. Pragati?
I think it would be collective action, and many apartment complexes have shown various models of composting, of waste management, of community gatherings. So collective action guided by care. So if you care for yourself and each other, I think that would be the best.
For me, it would be to think beyond the boundary walls of the residential complex, to bring along people that work for you, care for you, do things in your homes that make them run, that make your lives run. And if there was a way to extend the envelope of collective care also to people who are beyond your immediate household, that would be my advice.
Thank you. I missed out on one topic. Maybe some question will be raised on geriatric health. If we can get some questions, I'll take the topic.
Good evening, panelists. It's a wonderful panel discussion. My question is mostly when we talk about this traffic congestion problem in Bangalore, people even are using electric vehicles and all, but still I think there should be a model which should be enforced on the citizens as well as on the public, where we can also protect our health by using some vehicles which will release oxygen instead of carbon dioxide. What is your idea about that as a doctor?
Just merely listening to the idea itself excites me.
Not thought about it, but yeah, I think, see, there are a lot of other things that happens in pollution. It's not the lack of oxygen that causes the problem. It's exposure to nitric oxide, exposure to sulfur dioxide, carbon monoxide, like so many other things where the exposure is an issue, rather than lack of oxygen, which is the problem. So the way I see it is that the issue is like more holistic. We need to think about, I agree, we need to think about what are the solutions here, right? How can we protect the citizens?
Can I also respond?
Yeah.
I suppose if we could design traveling nurseries, like plant nurseries that we could power by cycle. So if you could go to work on a bicycle with a plant behind you, you could be walking or going to work, but also generating oxygen along the way.
I'm not simply taking my cycle or walking only. You're asking me to carry something else. But I like the word enforce in your statement.
So, yeah.
Yeah, actually, thinking more on that, I think more electric vehicles that are going to come, right? And I think that's one important thing. And also like construction activities. I mean, for example, if we take Delhi, construction activities in Delhi is a huge source of pollution there. I mean, Delhi has become unlivable. You go there and you stay there for a week or 10 days, you come back sick. That's how bad the air is. So I think all of that is also contributing, and we need to think about whether there could be a green construction that happens, right? So I think there is innovation that is required beyond health to really, when you think about how do we bring the whole environment really better. I'll give you an example, not that, this is the best example I can give. People quote what China did in the last, 10, 20 years to bring the pollution level down in Beijing. If it can be done in Beijing, I'm 100% sure it can be done in India. It's just that we need to put thought into it in a way that, their air quality, I hear, it's like 50 or less, right? Here we are living with, in Delhi, sometimes 600, 700 air quality index, or more than that. So I think there is something that can be done, and where multiple stakeholders have to come together to make this happen. Of course, planting more, plants are very, very important along with everything else that we do.
Hi, anyone? May I? Yes. I'm Srini, and I represent one of the community called G Code, which is Global Community of Industry Experts. In our space in Sarjapur, in a small apartment, we do urban health kind of an activities through an event where it can be a sing-along or something, a fun, and let kids as well as elder people get to know about it. If we really want to expand that, what kind of support that we can get from the forum that is available here?
Do you want to respond?
Yeah, I think, it's an excellent initiative bringing together children who will be taking up these issues in the coming years, as well as the wisdom, past lived experiences from others, bringing them out of loneliness, sitting, with their digital this. So if there are sort of many organizations who partnered to bring something like this together, I'm sure several such institutes would be interested in taking that up and translating it into other spaces as well. Could be educational spaces, workplaces, communities, apartments. So yeah, I think it's a great initiative. Maybe it might need to be sort of one-on-one contacts with a few people, and once that's picked up, media is a great place. So if social media or otherwise, if it gets picked up, then it can get into a branded communication series or something.
Thank you.
For that, I also want to add on. You can use your apartment spaces as a micro fitness spot, and you can also use your apartment spaces and plan some senior activities like farm to plate within your apartment complex. Grow your own food, maybe if not everything, at least potatoes. Or tomatoes, if potatoes are not healthy.
I have a question. Dr. Maheshwari, you mentioned about geriatric health, right? For elder parents, right, who have diseases around dementia, right? Is there any framework available or any system available for the society to really help those parents get back to their homes if they get lost? I'm asking this as a son whose father has dementia and kind of walks out and gets lost sometimes. It is a challenge, and as a citizen of the city, I don't think there is any place where we are coming together to create a awareness around this challenge. And more and more, my colleagues also, I see more and more people saying their parents are getting impacted with dementia because of the challenges that you mentioned, sir. Right? I mean, the social stress, loneliness, So, is there something that can be done by the Apartment Federation or the BEST cluster to come with a solution which creates awareness across the city that we need to be socially aware of this and be mindful of it and help our aging parents to get back home safe?
Framework wise, yes, there is a framework that's called as National Program for Elderly. If you can put it on, framework is already there. But implementation is an issue here because it's not as important as TB or polio for us right now. So maybe 10 years down the train, when it is the framework is already there, implementation strategy is there, it's not implemented because the need is not felt. So once that is there, then it will get implemented. But I have seen many NGOs working on training young individuals as geriatric help, or even educating children in the school that what all you need to be aware of having an elderly at home or elderly at the community. And if you've seen 25, 30 years before, even then dementia was there. If it was a village background, everybody would have known him. Okay, this person is this person's father, his name is this, he lives here. And even if he's at least 15 kilometers away and finds in some taluka headquarters, they'll find him and get him to the village. That kind of social awareness is required.
Actually, I think it's a very important person. So it actually personally happened to me. My father, he had a brain issue and all that. We're living in the US. So he got lost, okay? And he walked without shoes. And the road is very hot. And he's going to the end of the road and then standing there in the heat without realizing, his foot is getting really hot. So again, the neighbors recognized, and they're like American neighbors, and they brought him back safely. They called us, and then we ran, and because we were searching for him, where is he, right? And then anyway, we brought him back. His foot was kind of red because he was starting in the thing, right? It's very hard when you see that. It's actually an issue, right? When you have a urban society with an elderly, demented parent, getting lost and all that. So maybe one solution, of course, awareness is one thing. The other thing I can think of is like, have a electronic
Wearable
kind of a thing, like, where, right, there is a way that it can communicate or things like that. Right.
Yeah, thanks for this panel. I think excellent discussion, and good to hear things which are preventive rather than, going to a diagnostic center. I think my question is with respect to children. I think something that we didn't quite discuss. I think one of the things is with the work-life stress, parents themselves are stressed, they're not spending time with children. And I think this whole generation, with the requirement for them to excel in their careers and education and exams and all of that, I think the childhood is lost. So I think what we are also looking at is, how the next generation is going to go up and, besides all the other problems that we talked about that we have solution for, I think how do we get parents to step back and let kids be kids?
I think very important question, and with two little ones back home, I think it really hits home, because there are those stressful days when there is no time. And from the first child to the second child, I see the amount of digital exposure around. I mean, even though I make every attempt to keep it screen free, but just the amount of people that would have screens and would want to show, would want to engage, I think sometimes I worry what kind of a world are they sort of going into, communication. And there are studies that have linked, the delay of communication or many other things with early digital exposure. So this human-to-human connect that many of us spoke about, I think that's extremely important. And apartment complexes, since a large the audience is also belonging there, at least that provides some safe space for play, unstructured play, away from devices, away from constant supervision, but unstructured play. So making and creating and nurturing those spaces more within the complexes is potentially a way of.
Actually, one small thing I can add, maybe if families can adapt that during the dinner time, everybody comes together into a common place, including children, where they sit and eat. It's a simple thing to follow, but many families have forgotten. Right, people take their plates, sit in the rooms and eat.
In front of television.
Yeah, I think if some of the best practices I've seen in the current generation parents is something like this. So every day, maybe the grandparent, the parent, and the child, there are two children together, sit around the dining table, no electronics, put it away, just spend the 30 minutes together. That is a very simple practice to adapt that can go a long way.
This is a very costly affair, sir. Yeah, please.
Yeah, it's not a question as much. You mentioned about geriatric health, and I heard Satish talk about his issue, and asking if the federation can do something. So I think the federation can learn more than what it can give. If we can have you and a few others who faces dementia issues and come and talk about it, how you've solved it at your level, and maybe 2 or 3 other people coming and talking about it, and we can get an expert on the subject also, talk about it. We can do a webinar follow-up, Satish. Please reach out, yeah?
Thank you.
Yeah. Excuse me.
Yeah. There are 3 questions, 1, 2, and 3.
No. Due to the lack of time, this will be the last question.
Okay, who gets?
Please scan the QR code and your questions will be answered by the experts.
It's not a question, it's a comment. So. Okay, it's okay.
Wherever the mic is going, she gets.
Sorry? Shall I ask the question?
Oh, yeah.
Yeah. It's
She
not
got
really
it.
a question. I felt none of you spoke much about garbage. I feel garbage is one of the root causes of illnesses. See, garbage can, because of the stinking and it can cause air pollution, it can cause water pollution, and because the roadside garbages, the roads can get flooded because the drainage gets blocked, and people cannot walk whatever left footpath because garbage is there. Even the short distance to the bus stops, people cannot walk. That is one thing. The other thing, Dr. Swami mentioned that people who go in the car are more exposed to pollution. If you ask me, it is the people who walk or who go in the public transport are more exposed to air pollution, because people who travel in the single car with their windows shut and AC on, they cause more pollution than they are exposed to pollution. Whereas people who travel in buses, they are more exposed to pollution, I feel.
On the garbage management, I'm not justifying, but I mean, as a citizen of Bangalore, forget about me being a part of GBA. Now, when I'm seeing as a citizen of Bangalore, for street sweeping, we have around 50,000 PKs. For monitoring them, we have another 12,000. Then we have close to, say, about 6,000 or 7,000 garbage trucks. With all of this also, we are not able to manage it because of, I personally feel, citizens' awareness on segregation, citizens' awareness on where to place the garbage, everything. Having a separate department, having a separate protocol, having a separate fund, having separate manpower, we are still not able to do it. It's not that we are not doing it. Every day from morning 5:30, at least one of the commissioner level person is on streets to see if it's done or not. I'm not justifying. I'm seeing there enough effort put from that end also. Thank you.
No, but I think penalty is properly imposed.
Yeah, that's what when he mentioned, I said enforced. We don't wear helmet even though we know that road traffic accident will hit your head. So I think the only way is enforcement.
Yeah. And one more thing, sorry. Regarding senior citizens, I think BF can come up with area-wise some centers where citizens, I mean senior citizens, especially with mild cognitive impairment, can go in the morning and come back in the evening where they're...
That's my dream project. I personally have this project.
Actually,
something like a preschool, we should have a senile school at the apartment complexes. Yes. Apartment complexes have some preschool area dedicated for children. I think you should also have a senile school kind of a concept.
Okay, so I'm Dr.
designing
Anita.
one.
I'm Dr. Anita and I've been working on elderly welfare. So since people are talking about dementia and the idea and your vision, so actually I've been working on it from few years, and from past 6 months I've been working with University of Toronto, the professor who has initiated SSLD. So since we are looking, one thing is like, okay, from my school days, and I used to go to old age homes. Coming to Bangalore, before coming to Bangalore, I thought like elderly citizens should have a school where they go learn things as they are learning, not for learning, but for this cognitive and effective things. But when I came here, I saw elderly communities already available. So I was like, oh, okay, so how it looks. I'm living in Ojon Urbana, Equa. We have Serene Urbana. So it's a completely an elderly community. So I thought, okay, how these are differently constructed. They have different elderly, spaces. They have yoga. They have, medical facilities available in hand, etc. But no mental health assistance. So we talk about dementia and Alzheimer's, that is visible. But as we go elder, we'll be like, there are many more disturbances that happen. They need a weekly thrice or, weekly once or twice, some 1 hour, 2 hour sessions where they can control their behavior and all. So since sir was suggesting, so if the webinar part and all, I am ready, and I can also invite my team who is working on SSLD and that has been implemented in different countries already for elderly well-being. I can support with that.
That was a good
Yes,
pitch.
I can support with that.
That was a good pitch. Thank you. I'm not taking any more questions. She will say, you please get out. Thank you. Thank you once again.
Thank you. Please scan the QR code and answer the questions will be answered by the experts if there are any. A heartfelt thank you to our panelists for a truly engaging and insightful discussion. Your perspectives have deepened our understanding of sustainability. May I now request representatives from Bengaluru Science and Technology Cluster and Bangalore Apartment Federation to kindly present mementos to our panelists as a token of appreciation. Dr. Sundar Swaminathan.
Almost there. Thank you so much. But the same campus.
Dr. Pragati Hebbar.
Thank you so much for coming.
Mr. Rohan Patankar. Dr. Maheshwari. I now invite all our dignitaries to kindly join us for the front for a group photo. As we move forward, we now transition into an exciting segment of today's program, the Flash Talks. These are short, high-impact presentations that spotlight innovative ideas, emerging solutions, and real-world applications in the field of public health. Today, we have 3 Flash Talks focusing on air pollution, extreme heat and vulnerability, and preventive health. Please join me in welcoming Apekshita Varshney, founder and executive director of Heat Watch. Apekshita's work focuses on addressing the growing challenges of extreme heat and its impacts on public health, communities, and urban resilience. Through Heat Watch, she is driving awareness and action on one of the most urgent climate health issues facing our cities today. What's wrong? It was just blank.
Hi, good evening. Thank you so much for having me here, and I'm very excited for this talk. It was great to hear the panelists discuss heat stroke because that is one of the biggest challenges we face, not just in India, but around the world. So I'll begin with my flash talk, and apologies for how fast I'm going to speak to cover quite a bit that I want to about extreme heat. So after a very brutal summer and an ongoing heat wave in parts of India, the conversation is back in vogue because Europe is facing an extremely bad heat wave at this point. And this is particularly important because extreme heat and heat waves are no longer a side or a fringe issue. It's the biggest hazard of our times, and we have studies to back that up. So the Lancet study is actually reporting 546,000 deaths every year, which comes to 1 death a minute because of extreme heat. A study by Professor Gadgil and Professor Narang shows that in India, every heat wave event causes an excess of 3,400 deaths. Single heat wave event. So you can imagine that as the heat wave days are more and more around the country, what that death number looks like. And we have absolute opacity in terms of data, in terms of understanding what extreme heat is doing to our society. Bengaluru, considered of course a very cool and lovely place, as has been highlighted by the panelists here, is no longer as cool as it used to be. We have data, again, you can see the diagram here to show what the temperature rise has resulted in for ambient air temperature in Bangalore. So 1 to 3 degrees higher in urban heat island areas. Urban heat islands are densely built urban spaces which trap heat and do not allow for that heat to dissipate because of encroachment on green covers, lack of not just green cover but also blue and green infrastructure essentially. 36.8 degrees recorded in April 2026, 35.6 recorded in March 2026. So we're looking at increase in ambient air temperature for a city like Bangalore, which tells you the impact that it's having in not just a city that's 900 meters above sea level, but other parts of the country which are traditionally and historically way hotter. This kind of heat does not impact everybody equally, and that's something that we all recognize, but just the sheer amount of impact of extreme heat on vulnerable populations is still not well understood. So at Heatwatch, we've been trying to document and understand the impact of extreme heat on outdoor workers, on informal workers, and one study that we carried out with Hasiru Dala last year on waste workers found that 92% already find that heat makes their work more difficult. And this has direct impact on their income, this has direct impact on their expenses. 86% have reported lower productivity. We're a country of 90% informal workers, workers who are self-employed, who are trying to make money by themselves, and extreme heat is creating additional impediments to their work. We've been currently working with domestic workers in Bangalore, supported by the Bengaluru Sustainability Forum, and we're finding just from a qualitative study of 40 domestic workers in the city that 20 out of 40 domestic workers avoid drinking water because they don't have access to toilets, not just in homes of the people they're working with, but also in apartment complexes. 17 out of 40 feel unable to rest, unable to hydrate, unable to slow down because they have to meet certain targets to be able to take home a minimum wage, not even a living wage. This has severe impact on the health of workers who are vulnerable, already economically precarious, and now extreme heat is pushing them to the edge. So for waste workers, again, we've seen 72% have reported muscle cramps, dehydration, kidney issues. Dr. Swaminathan was talking about kidneys are the canaries where extreme heat is contributing to the biggest and the most profound impact. And the chart on the right also shows you the number of illnesses that domestic workers are reporting. These are considered workers who work indoors, are traditionally not as affected by extreme heat. But our study finds that in transit, in going from one house to another, living in low-income settlements, often far away from their workplace, extreme heat is causing a big impact on domestic workers as well. There is a big element of gender here, there's a big element of caste here. Even within the disproportionate impact that people face, we cannot ignore the fact that occupation in India is very closely linked to caste, is very closely linked to gender, and there are significant impacts on people's health which extreme heat and climate change is contributing to. two initiatives that I want to discuss, which we've put together. One is a campaign to keep parks in Bangalore open, which is a very, very simple ask. Keep parks in Bangalore open throughout the day. Do not shut them in the afternoons, because these are spaces where people who work outdoors can go to rest. In fact, build parks as cooling centers. Build them as centers where there can be access to water, can be access to washrooms, and can have additional densely forested areas which can actually serve as cool spaces. Another example is a charter we've developed with the Bengaluru Apartment Federation for guidelines on how really to work and secure the livelihood of your domestic worker. All of us employ domestic workers here, but when it comes to occupational hazards for domestic workers, we often forget the fact that we are employers ourselves. So what can we do to make sure that domestic workers, staff in our apartments are protected? This is something that we're very happy to collaborate with BAF on and hope to continue building. But these are solutions which are really sort of at the beginning of how much needs to be done. And there's a lot more that needs to happen, which is to begin with recognizing the significant and serious impact that extreme heat is wreaking havoc in our lives already and will continue to by all projections of climate change. I'm not trying to alarm you, I'm trying to tell you that this is something that we need to recognize, we need to protect, and we need to act. Final solutions that I want to put forth. Number one, recognizing extreme heat as a national disaster, which has still not been done by the government of India, and an occupational risk. Most importantly, protecting those that are most vulnerable, protecting workers with clear not just guidelines, enforceable guidelines, actual financing, enforceable norms, and income protection. Cool cities, we cannot do any of this until we build cities which are actually cool. So all the conversations around traffic, around pollution, all of it comes together from the lens of extreme heat, where we try to build cities which are actually cool and can actually secure the livelihood and health of people who live in these cities. But most importantly, aspects like shade, water, open parks, cooling, all of these become extremely important when it comes to periods of not just extreme heat days, but throughout the year when temperatures are being recorded as breaking absolute records. And finally, strengthening social protection. We have to think about the kind of income loss that most vulnerable workers are experiencing because of extreme heat, and we need to come up with better and stronger social protection systems for exactly securing the health and livelihood. Finally, my final sort of urge and request to all of us is to really start thinking of extreme heat as a hazard that's here to stay. And unless we think of those who are most disproportionately impacted, we cannot be talking about fanciful ideas like climate justice or climate resilience. Thank you.
Thank you, ma'am. That was very informative. Please join me in welcoming Dr. Prakash Doraiswamy, Sector Head of the Air Quality Team at CESTEP. Dr. Doraiswamy's work focuses on air quality management, emissions, and environmental health, helping shape data-driven solutions for cleaner air and healthier cities. His insights critically as air pollution continues to be one of the biggest public health challenges in urban India.
Thank you. Good evening, everyone. So that was a very impressive panel discussion and followed by a very actual flash talk. Mine will be more like a presentation that will end in a flash. So I'm from CSTEP, which is a think tank based in Bangalore. We are located in Hebbal area, and our vision is to enrich policy making through science and technology. The panel discussion actually set us up very well for to talk more about air pollution. So just given the wide background here, I wanted to just quickly go over some basics before I get into the topic of the day of what's in the air, what is it that we breathe here in Bangalore, and some quick results from our work. Obviously, the sources you have both that's natural, that is including some of these dust emissions from plants, volcanoes, lightning, etc. But mostly what we are worried about and focused is on the sources that are man-made, which are referred to as anthropogenic sources, which includes everything that you see: industries, cars, transport vehicles, or waste burning, open burning, diesel generator sets, eateries, etc. In some of the common air pollutants, again, Dr. Swami referred to some of these, and these are some of the common air pollutants that we are really worried about. The most talked about here in India, at least, is the particles, or referred to as particulate matter, and I'll get to that in a moment. These are the different sizes that Dr. Swami also mentioned. Of course, then you have all these gases, nitrogen oxides, which is actually collectively, it's referring to nitric oxide and nitrogen dioxide, and it's collectively referred to as NOx. You have sulfur dioxide, you have volatile organic compounds, then you have carbon monoxide, elements, and metals. Of course, most of these are combustion-oriented sources. I think anything you burn then generates these. Particles obviously comes from combustion sources, as well as any of these other, typical like construction activities, road dust, earth moving activities, those types of things. And the other thing that I want to point out here is not all of these are emitted directly, right? So some of these, like for example, ozone is actually formed in the atmosphere. It is not emitted directly. It's chemically formed in the atmosphere from these gases, now nitrogen oxides and volatile organic compounds. Likewise, some of the particles are also not emitted but actually formed in the atmosphere, and we refer to those as secondary particles. Why that is important is that you are not going to be able to bring the particle concentration, you are not going to be able to improve the air quality if you focus on only those that you see, but you really need to control those precursors, which are actually the gases that result in these air pollution. Now, I'm going to focus exclusively on the particles today because that is mainly the pollutant of concern here. This is a figure that's, that is obtained from US EPA. Just to give you a perspective, a human hair is about around 70 micrometers in diameter. And we are talking about PM10 and PM2.5, which is 1/7 or even smaller than the human hair. So, and these particles, like Dr. Swami also mentioned, are invisible to the naked eye. And because these are so small, they obviously pass through your nose is actually a natural filter for larger particles, because it has to, if you think about it, you breathe in, it has to make a very sharp U-turn and then go inside, right? And so anything that is really large particles then get filtered right here. But these smaller particles behave more like a gas, so they just go in and then go into your bloodstream, and again really crossing this blood-brain barrier and resulting in all of these health effects. Now, this is a work that is published in the journal Lancet, and it's by all these health experts from across the world coming together, including folks from India in the ICMR as well, being part of this. Why do we even need to worry about air pollution? Obviously, because it has both mortality impacts, meaning early premature death, as well as morbidity impacts. Morbidity meaning other health outcomes like even any of these other things like dementia. It's been linked to dementia. More recent studies are linking air pollution to dementia. Any of these neurological impacts as well. So out of about 7.9 close to 8 million deaths are projected to happen caused by air pollution globally, of which about 25% is happening in India. And of course, the remaining 25% is, the other 25% is of course in China. And so it's really very important for us to manage. Before I kind of tell about the air quality here in Bangalore, I think it's important to also understand just some basics of what really determines the air quality in your area. Obviously, you have all these sources. When these get emitted into the air, it undergoes these physical and chemical transformations, chemical reactions, and some of these kind of grow in size as well. They condense. And of course, it gets transported by wind, right? So it doesn't stay there, it gets transported by wind. And finally, of course, it gets cleansed by rain, which we refer to as wet deposition, or over time, it just gets deposited on surfaces, whether it's plants, buildings, or soil. Now, with all of this, what's really modulating is what's called as the boundary layer, which is basically a layer within which the air is very well mixed. And even if you think about it, as the sun comes out, the air heats up. And so as the air heats up, then the volume expands. And so that volume within which your air pollutants mix gets larger and larger during the course of a day. Now, same thing, so this is a kind of an example of how that boundary layer may look like, right? It's an invisible layer. All of your pollutants are trapped within that. Now, during winter, because the temperature is relatively lower than what it is in summer, it's trying to mix within a much smaller volume. So think of this as a roof. This roof will come down to your head level during winter, while during summer it's here. But you're burning the same, let's say you're burning 10 incense sticks in this room, the concentration will be much higher in winter. So that is why you typically see concentrations being higher during winter time than summer time. Now, what this means is obviously, typically this is why most often we hear meteorology being blamed for air pollution. But the reality is, if these emission sources weren't there, meteorology is not going to create bad pollution. It's because of these emission sources that result in this bad air quality. So it's really important for us to kind of control that. Now, this is actual data from all the sensors in Bangalore. We have some of these were deployed by us. Some of these include the regulatory monitors that's deployed by the Pollution Control Board. And this is an average across all these monitors in Bangalore and the sensors. It's about for 1.5 years. It kind of shows you the pattern where, what I just referred to, you kind of see the concentrations going up during winter. That's the yellow color. And then, of course, during the monsoon season, it's the lowest, right? Obviously, because it's cleansed by the rain. And, of course, during winter, because of this, physical process that I was referring to, but also there's also change in wind patterns and everything. So you can look at it this, on the y-axis you have the what we call as a concentration, which is basically how much particles is there in the air. It varies anywhere from, around, on average, if you look at it, probably around 40 or so over the, the entire period. But during winter period where it goes up. Now, the National Ambient Air Quality Standard for India for particles is 60 microgram per cubic meter for daily average. In other words, every day the concentration should not exceed 60 microgram per cubic meter. So you're seeing from this graph that at least during winter period, there are days where the air quality is going to exceed the National Ambient Air Quality, the Indian National Ambient Air Quality Standard. And this is just the same information presented here. The blue color presents the percent of days that exceeds the National Ambient Air Quality Standard in Bangalore. On average, obviously some places you have about 25% of the days, but on average it's about 13 to 15% of the days, and most of it happening in the winter season. And this is just an average if you want to look at by these GBA zones. Mostly we are seeing higher, poorer air quality or higher particle concentrations in the east, and then followed by north, and then of course you have this non-GBA area that's outside the GBA boundary. Now, I want to also kind of share this resource that is available. This website, this profile portal has been created by Rainmatter Foundation along with Auditorium, which is a sensor manufacturer. So they brought in all data that is there in the open domain. This is free for you to use. It has nice interactive features for you to look at. So that is the website address. I would really encourage you to look at it. So all the data that I showed from our sensors is also available on this portal. So you can access this. Of course, it has data for Bangalore as well as for other parts of India as well. Now, okay, now we have these, we are seeing this much of concentration. What does it really mean in terms of the sources? So this is kind of digging it further. What we showed there was PM 2.5, that is anything that's less than 2.5 microns. Now we are taking that even further and seeing, are there even smaller particles like PM1, which is 1 micron or less. So basically anything that's in yellow is very small particles. We call it as ultra fine, that's the PM1. Green is just between 1 and 2.5, and the whatever that color magenta is anything that is larger. So we are really focused about this. What I want to point is two things. On the top you have for Kolkata, West Bengal, and then on the bottom is for Bangalore.
So you see for Bangalore, you're seeing the shift in where, during winter, you're seeing a larger fraction of these smaller particles, the yellow color and the green color, while during other seasons, it's the magenta color is larger, meaning more of the dust-oriented sources during summer. While in North India, pretty much throughout the year, at least for this time period when we were looking in Calcutta, it was almost 70-75% is everything like really small particles. So basically originating from combustion source. So this kind of tells you that during summer, the sources that influence here in Bangalore are different from the sources that impact the air quality during winter season. Because during winter, you're seeing more of the smaller particles, which means they are originating from burning, any type of burning, whether it is industries, whether it is power plants, whether it is open burning of waste. So it is mostly related from combustion source. Now taking it further, this is again results from our office. We have advanced instrumentation there at our office in Hebbal. Basically it tells you what is in this particle. So far we looked at the sizes, 1 micron, 2.5 micron, 10 microns, but within that particle is composed of many species. And so within that we were trying to see why, what are the different species that are there. And what does this tell us is because depending on the source, each source emits different pollutants or even these species, which is we refer to as more as a marker. So if a certain species is dominant, it likely refers to influence from a particular source. So based on that, then we can really figure out what sources contribute to the air pollution here in Bangalore. And based on that, and what we are finding here is obviously traffic is a pretty dominant source. Biomass burning, which is anything, that could also include biomass and waste burning, which biomass is anything vegetation, plants and stuff. So those two are kind of the major local sources. And then we are also seeing what I refer to as the secondary sources, and it's mostly regional, coming from outside Bangalore. So you are obviously seeing what we are breathing here is a mix of what's generated locally as well as coming from outside. So this is my last slide, and some of this were touched upon in the panel discussion also. Because obviously transport is one main source, waste burning is another main source. What is it that we can do? And this is only for what we can do as citizens. Of course, government has its own responsibilities, industries have their own responsibilities. But these are some of the things that that we can actually as citizens do. One, of course, we can take pool car trips together, carpooling, combining errands as much as possible. Basically, the idea is to reduce the amount of time, amount of driving that you do. Even better if you're able to shift from private to public transport where multiple people travel together. Phase out older vehicles. Even if you own a vehicle and you can't really avoid not using it for whatsoever reason, at least maintain it well. Some of these what we call super emitters result from very poor maintenance. So if you're able to maintain it well, then it will reduce these amount of pollutions come. Diesel generator sets is a big source, particularly for Bangalore in India. Bangalore is one of the hotspots for high diesel generator sets. And of course, waste generation, we talked about waste burning, but most of it comes from improper waste management, again, going back to segregation and sorting. So I'll stop here. Happy to take, discuss further in the networking session if you have any questions. Thank you.
Thank you, sir. That was a very insightful talk. Please join me in welcoming Shankar AG, Director of Programs at Swasti, the Health Catalyst. With extensive experience in community health, social development, and system strengthening, Shankar's work focuses on improving health equity and enabling vulnerable communities to access better healthcare and well-being outcomes.
Good evening, everyone. Thank you so much for the opportunities to speak about the preventive health specifically. Okay. Let me take another couple of minutes to talk about the story of Lakshmama. She is 60 years old. and she lives in Bammanahalli, Bangalore South area. And she has been diagnosed with the diabetes as well as hypertension, but the last test was done almost 8 months ago. But no one is following up, and she has been taking medication, but whenever the symptoms are increasing. Okay, so at a time she had a stroke and admitted into hospital, and the family has to borrow money, and again trapped into the debt. So it's not about system crack there, but it's also about, okay, it was not built for her. So basically what I'm saying, the system is there, health system is there, but at the same time system is not really meeting the requirement of the community. So like the Lakshmamma, there are millions of people who are experiencing these kind of challenges. This is just to give you a the glimpse. We know that Bangalore is rapidly growing. The interesting data what we seen is every day 1,000+ people, the residents added to the Bangalore. So inflow is increasing, but at the same time we are not coping up with that kind of the required health infrastructure and also preventive health mechanism that needed for communities to live. I think you can see the two trends here. One side you see health system, another side you see the neighborhood. The health system, there are hospitals, there are clinics, there are pharmacists, there are the specialists, either private and also the public sector. But at the same time, the neighborhood, where you can see that where people are living, right? The Lakshmamma, again diabetic, and her son is a Raju gig worker and no health insurance at all, despite having access to health insurance. And Priya is anemic, Raju's wife, and child is missed vaccination. But we also interestingly see the gap in terms of the lack of continuity, poor trust. Many people the bypass public health center because of various reasons, and also the lack of relationships, and the poor safety nets for people. Of course, the below poverty line we have government health insurance, and above the rich people having their own insurance because they can offer. But at the same time, many the people who are in the middle, they do not have access to the health insurance. This is give you just another glimpse of the data. The panelists had a deep dive in terms of how NCDs are affecting the people in Bangalore. Of course, these are the few data where I thought of presenting, but at the same time there are many health issues still we can dip. And another interesting point you can notice here, 70% of the people paying their out of pocket, which is really alarming. And altogether you see the more than 50% of the cases are undetected, are undiagnosed, hidden. We live with that. I think that's the aspect we should keep that in mind. Let me introduce a character of Sunita here. Sunita is a health worker, and she has a system. The system flags the reminder where she wants to meet the Lakshmamma. She visits, and she do the health interventions. And during her visit, she found the Priya, her daughter-in-law, having exhausted, looks exhausted, and Sunita asked how she is doing, and Priya reported tiredness and almost in the past few months. Then the testing was done, hemoglobin test, and her hemoglobin was almost 9, which is low. The efforts of Sunita is about the Lakshmamma's medication sorted out, and Priya's anemia testing is done and treated with the proper medication, and child's vaccination is also updated. So in this case, nobody went to hospital and nobody paid out of pocket. But after 2 months later, both are really doing good. So this is a kind of reimagined health intervention by the Sunita. The right hand side, where you see the picture where we have community health workers from the community being trained. They have a the digital innovations to do the testing at the primary level, do all intervention at the primary level in order to ensure prevent people from diseases. This is just to give a glimpse of in terms of how people system, the centered systems work. It's not about keeping system at the center, but here we are keeping the household or people at the center, do intervention around. So everyone play the enabling role here, including diagnostics, the medicines, PHC, health worker, and digital innovations, etc. should be navigated towards the household, rather the system expecting communities to come. It's the ideal, but at the same time it may not happen situation like Bangalore. So in Swasti, what we do, we look at the Rasta strategy, go to community, onboard every family, every individual at the family, do the risk assessment, do the screening using point of care diagnostics, testing. People require further testing will be navigated, but at the same time proper treatment, timely treatment, as well as active follow-up, which is very critical. I think during the panel discussion, there was a deep dive around the social determinants of health, social and commercial determinants of health, including the the climate health impact on the health as well. So which is very much needed. The health workers, what we have, they look at everything from the bottom to end. But when any people require further navigation support, those people are navigated to nearby public health system. That's the core work they have been doing, along with addressing some of the social determinants of health, including financial literacy, facilitation of social protection schemes, because in India we have more than 1,000 schemes, at least I could say more than 250 schemes are working, and including the government health insurance at state level as well as the central level as well. This is give you a glimpse of in terms of how people-centered primary healthcare works, as well as the patient's journey. Ultimately, the outcome that we look at is about improved clinical outcomes, reduced hospitalization, lower out-of-pocket expenditure, as well as equitable health access, timely and the equitable health access. This is, I think, over and over, our governments have been invested in generally secondary and tertiary care, hospitals, infrastructure, which is good, but at the same time, the cost of the health is higher, right? When you invest little bit on the prevention, definitely the cost of the secondary and tertiary care will come down, but at the same time, the morbidity and also the health issues also will come down over the period. I think that's the graph that summarizes. I kept it as reimagined, of course, in some states and some districts are happening, but at the same time, long way to go to reach that milestone. I think these are the few data points are the exemplars I would like to say here. In Brazil, you see the 40% reduction in infant mortality because of people-centered primary health care, and in Thailand, 60% catastrophic health expenditure has been reduced, and at least 80 to 90% of the health issues can be addressed at the primary level, household level, if you have proper preventive healthcare model designed for community, not designed for health system. So one more thing, what we do, any program we design with the community, understanding the lived realities of the communities and see what works best for them. It's not about what works for us. Yeah. This is another Bangalore, the I4V program, Invest for Wellness program, what we have been implementing in multiple locations. This is a learning lab for us where we are learning here, and also we are also working with some of the governments, the cascading these learnings and also outcomes, so that governments can also adapt some of the framework and also the tools that we created, so that it's not that we do everything, but at the same time we can do it together, because government has capacity to scale as well. Yeah, this is I will end with health. The health is not another any single or government's business, but it's also about everyone's business. So we know that there are many people, many the vulnerable communities. They have been supporting us and making our life easier, but at the same time, how we can remind them about that testing, the prevention and accessing health insurance, etc., so that their, the life is also healthier and also happier. Thank you so much.
Thank you, sir. I invite all the Flash Talk speakers to come to the stage and accept the mementos and for a group photo. I request Vinita and Mansi from Bengaluru Sustainable Forum to present the mementos. Apekshita Vashne. Mr. Prakash Doraiswamy. And Mr. Shankar A.G. I request everyone to come forward for a group photo. As we come to the end of this public talk series on the science for sustainable urban living, we would like to thank each one of you for being part of this journey with us. Over the 6 episodes, we have explored most of the pressing challenges and opportunities shaping our cities, from waste and water to mobility, energy, farming, and now health. These conversations remind us that building sustainable cities is a shared responsibility, and meaningful change begins with a dialogue, collaboration, and community action. We hope the series has sparked new ideas, deeper reflections, and stronger connections. We also encourage you to visit the stalls in the lobby to experience sustainability in action. And do join us for networking tea, where conversation can continue and new ideas and connection can take shape. Thanks a lot.